in DNB.
DNB, NEET PG, and also for I think super specialty, because NEET MDS is already over, so they cannot apply for that. So rest of the exams, I think for this year, they are going to follow this pattern.
Okay. I think Madam has not joined. I'll just remind her. I'll call her and remind her. I have to go out.
Okay, ma'am. Okay.
Good evening, everybody.
Good evening,
Good
ma'am.
evening, ma'am. Good evening, ma'am.
So, how many of you read the articles that were shared?
Uh,
Good evening, Madam.
Good evening.
Yeah. So, Sandhya, can you call others, Narendra also? Because except Meenakshi, I think all others will join.
Yes, ma'am.
I'm,
I'll do that.
yeah. Uh,
Okay, has anybody read any of the articles which I had shared?
Ma'am, I
okay.
was trying to read the book, one of the chapters from the book
Yes.
you had said, madam.
Uh,
And I was trying to go through the contents and I was trying to read the same matter from some other article.
uh-huh.
But I guess I felt that I'm still at a very budding stage to understand these all, how to fabricate MEQs and MCQs. Maybe
Mm-hmm.
probably down the line, after a few more classes, I will have a concrete idea to how to go ahead with it.
Okay. Anybody else?
Mm.
Even ma'am, I tried. It is very difficult because I think I'm beginner. Till now, I did not made any question papers.
Uh-huh.
So I was
Okay.
understanding. Now I understand. I got one idea how to
Mm-hmm.
formulate a question, and how we are going to format a long question and short question. Yes, ma'am.
Very good. Anybody else?
Sorry, ma'am. I could not. I didn't go through it. Uh,
Okay, the idea of sharing those articles were that you would get some idea. I didn't expect you to understand everything that was given in those articles, but at least if you had gone through it, you would have got some idea as to what we are going to discuss today. Okay. Any questions on what we had? What did we discuss last week? Any doubts? Any questions? Any comments you want to make?
ma'am, actually, I tried interacting with a few of my junior colleagues in my department,
Mm-hmm.
and because particular our internal assessment is just happening for one of the batches, so
Okay.
I just called them and just asked them few questions about um uh, how much time you spend making a question paper,
Mm.
and what do you, I mean, I did not give them any background. Then I just asked
Mm-hmm.
them very offhand,
Mm-hmm.
yeah, after the internal examination, what do you do?
Mm.
Um, uh, then I told them, okay, we'll have a discussion next week in the
Okay.
department.
Okay. Good.
So the answers what they gave was, no sir, sometimes you remind us ki afternoon there is internal, so within
Mm.
1 hour we make a question paper and send and send it to you.
Uh,
We mix and match previous question papers.
mm.
So it is done mechanically, which even
Yeah.
I realized after listening to your lecture last week, one thing we realized is all these years we have been doing the same thing, including myself. When I was at a junior level, also we never thought of too much about any question. We just often, we just wanted to make a paper, so that there is no conflicting topics in the same
Yeah,
paper. Try to
that's
cover as much as possible, and just finish the paper.
finish the paper, finish the job. That was the
Yeah,
idea, right?
exactly, ma'am.
Yeah.
Exactly.
Yeah. I'm sure Dr. Suhasini, who is taking the blueprinting this time? Topic on blueprinting?
Madam, you are
Kathy,
muted, ma'am. Muted.
am I?
Nagda madam is muted.
Oh, Nagda madam is muted. I thought you
Madam, actually, I was thinking of Manohar, but certain things later I thought that if we both can do it, I will do it and with your help, because the dental focused it will be.
Sure. Because blueprinting is
That
something which is very, very essential for both theory as well as for clinicals, practicals. If you're taking OSCE or practicals, spotters, whatever it is, you need to prepare a blueprint for your examination. Unless you prepare a blueprint for examination, setting up a question paper also becomes very arbitrary. As you rightly said, whatever comes to your mind, pick up some questions from the previous exams and make a paper. That is how the things go on. But if you really want to do it systematically after going through this course, which Dr. Suhasini has put up so well, so you need to be more systematic and doing it much more maybe scientifically rather than just doing it offhand like that. Okay.
Yes, ma'am.
So, yeah.
Madam, since they have some time till one or two people are coming,
Okay.
can you say what is blueprinting? Arun, Rohit,
Anybody who has any idea
Shilpa,
about what is blueprint?
Narendra.
Not in terms of education, but uh, most of the architects do blueprinting. That is all we
Yeah.
know.
What do they do?
What do they do?
Very good that you thought of architects. What do they do by blueprinting?
They have, whenever they have to design a building, so they go through from the foundation till the final, the finished product. They go step by step and construct it and put it on paper. And
Exactly.
it is, I mean, anybody who looks at it will have an idea about how, what is the planning behind it, and what is going to be the final outcome.
Very good. So, your exam papers should also have a similar plan, a blueprint as to
So what is the first step?
how would you go around doing it.
Ma'am, syllabus.
Very
Okay,
good.
come more narrow down. Syllabus
List
is
of
vast.
topics. List
Yes,
of topics.
still yes, very good. List. Then
Learning objectives, SLOs.
yes, that
Exactly. Very
is
good.
the key. ILO is the key. Specific learning objective, or the ILOs are such that you must know what is the it is taught, the learn what was the objective of teaching that, and how do you want to test them. What comes next?
What comes next?
The type of assessment to uh, check whether the objectives are uh,
But
attained or not.
before that, you want to know the level of the learners, no? Whether they are
Okay.
in the first year or final year or MDS, and also their,
Madam, that would be clear in the objectives, no, madam? Because learning objectives
no,
would be defined for.
learning objective, you say that the end of the session about the border molding material, the student should know to the properties, the manipulation, and also the attachment of the muscles, and whether they have captured it, whether they can check it. All these things are your learning objectives.
Okay, year
Learning
wise.
objectives can be more step by step higher as they go application and other things in the domain. So that is one important thing. Second is,
Can
as
we
you said, what, huh?
can we hear from somebody else also?
Ma'am, preparing the question banks, assessment methodologies, what we are going to be assessing the students
Uh-huh.
when we are objectives to assess them in the end of the curriculum.
No, in the blueprint we said we are going to put the SLOs. After that, what else do you put up in the? What else could go in a blueprint?
Stages of attaining those SLOs, like formative stages of formative stages.
Can you explain that a little bit?
Like if there is 10 months to finish the course, so at every 3 months we usually have a formative assessment. So deciding the stage at which we do the first, second, and third formative assessments.
Okay, you decided on the first formative assessment. So for that, you're preparing a blueprint.
Um, the
Yeah, have you
personally,
heard the term hutogogy? Hutogogy?
pardon ma'am, pedagogy.
What is pedagogy? What is andragogy? And what is hutogogy?
Yeah, there was a section on that.
Yeah. What is pedagogy?
Uh, Teaching younger age subjects.
Younger generation. Okay,
Yeah,
children or
children.
adults.
Android,
Andragogy.
Andragogy.
adult teaching.
What is hutogogy?
Self-directed learning.
Self-directed learning. Very
Self-directed
well.
learning.
Learning. And are we all at a stage for hutogogy?
We are, ma'am.
You are. That's why you have joined this course actually. So, what I would suggest, Dr. Swasini, for blueprinting, no,
Huh?
we'll ask them to present.
Yes, madam.
Hmm?
Yes, flip. We'll flip it. Yeah.
Yeah, so that we will help them out and they can present.
Yeah.
Okay, let them prepare and discuss with you and me earlier before presentation. Two of them or three of them can combine together and present the topic. Okay?
Yeah. So here you will have what is the objective, like we did in the self-directed learning. What is the that it's that you are told to learn and present and make others also understand, and all those things, distribution of the work to all your colleagues, all these things will come. Yeah. Sandhya, can we start?
We have
Madam,
seven.
Madam, I
Yeah.
tried calling Jyoti Madam and Mirna Madam. My call is not going. Actually, I'm not at home. I'm outside. So there is a
Okay.
range issue. Probably that is why I didn't get their call.
No,
I'm
we
not
will
able to
start.
connect
They
with
will
them.
join as usual at 10 minutes late. I think
Okay,
we'll
ma'am.
start. Yeah.
Okay.
Okay.
Shall I share my screen then?
Yes, ma'am.
Yes, ma'am.
If I say my entire screen, I don't see my PPTs here. No? Where is that?
Share the win. Huh.
No, if I share the window, is it?
No, madam, it's actually the entire screen.
Hmm.
But if you can try the other way also because this is Google Meet.
I know. Google Meet is a little tricky.
Very tricky.
Ma'am, directly you open your presentation
Yeah.
and then share it. It will come directly, ma'am. You open it and put it on the slide share mode.
Okay. It is on the slide share mode.
Yeah. Now, ma'am, just you present it here. Present now,
Share. Share.
and
Okay.
then window or entire screen, and next share it will come.
Your entire screen. Okay.
Yeah, ma'am. And then minimize this window, and that your presentation will be shared, ma'am.
Yes, madam.
Ma'am, just minimize this window.
This one, no?
Yeah, yeah. This window just minimize,
It's not.
or just keep.
Escape.
No, ma'am. Your presentation is open, ma'am. Click on that. PPT is showing open. Just click on that.
Yeah.
Yeah, yeah. Now put it in the slide share mode.
Is it visible now?
Yes.
Yes, ma'am.
Yes.
Yeah.
Yes, ma'am.
Yes.
Yeah. So last time we saw long essay questions, right? Now this time let's look at the other three kinds: short essays, SAQs, that is short. What does SAQ stand for?
Short answer questions.
Short answer questions. And MEQs for
Mm, and
modified. So just
modified.
yeah. So look at these questions. These are asked as short essay questions from some university. The question paper it has been taken. Okay. Galvanism, dyes, discuss selective pressure impression, retainers in fixed. Okay. You all have read this. Shall I move forward?
Yes, ma'am.
Okay. Now keep these questions in mind, and this is the checklist, and for each of the questions that we have seen, apply this checklist and see what is your, tell me the answer. Let's take the first question that has been taken.
Galvanism.
Galvanism. Okay. Can one of you read it? The checklist, the first item on the checklist.
Has either the phrasing or construction of the question properly done?
Hmm.
Zero.
What's your opinion about it?
Absolutely no.
Absolutely no. Why you say it's no?
Because it's just a single term
Hmm.
and doesn't even give. Just because it is media student, the students have to imagine that it should be connected to dentistry.
Yeah.
Otherwise, galvanism could be connected to any field in science.
Any field in science, absolutely. So it's not, it's not phrased properly. The second check. So this scores negative on the first item, right? Second
Yes,
one,
ma'am. Answer is yes.
yes. As you rightly said, it can be interpreted by different, sorry, different people in the, why am I going? I'm sorry for that. Okay. Hmm. Third point. From any of these questions which have been put up, can you make out what the learning objectives are?
Mm,
If you have taken down the questions or you want me to go back to the previous slide, I, ca-
Ma'am,
I would suggest you take a screenshot of this so that when we go to the each question, you will be able to say which of these have got a proper learning objective. From for this question, you can make out what is the learning objective. Can you see?
no, ma'am.
None of them.
No. D and E, I think still, we can
Ma'am,
make out.
D and E is
E, okay, and E are better, right?
Yes.
yes, ma'am. Yes, ma'am.
Okay. Suppose these questions were given for 5 marks. That means roughly for each mark you are giving 2 minutes, right? So 10 minutes. Is 10 minutes sufficient to answer these questions?
ma'am, question D and E are they elaborate, so we can answer them, but the rest do not have any directions.
Any direction. So very difficult to answer. But as I don't remember who said it. One of you said that they give short notes in your question papers, right? And short notes are usually of this pattern. Am I correct?
Yes,
Yes,
ma'am.
ma'am.
Yeah. So there is no direction. You cannot make out what the learning objective of giving such question is. You are not giving them sufficient time to answer the question, right? Will there be objectivity when the answers are valued by different examiners?
No, ma'am.
No. So, and finally, any other factor that you want to comment on when you're looking at these questions?
Madam, sometimes it looks as if when you say short notes, the question also has to be short.
That is the impression that is given by the examiner, that when you say short notes, the question needs to be short. But any question that you are asking should be clear, should be based on a learning objective, should be should not be open for multiple interpretations, and should have sufficient time to answer. So when all these points have to be covered up, you think short notes need to be short?
No, it has to be elaborate, very
it
elaborate.
it needs to be elaborate so that the student knows exactly what is expected of him or her, right?
Ma'am, but
Yeah.
the same questions could be asked for long essays also, ma'am. So in that case, the student has to see the marks and then construct the answer. That's how
Yeah, correct.
people expect.
So when
Yes,
you
ma'am.
are giving a question, you need to think about whether the marks that you are allocating are sufficient for that answer, right? If your answer is one liner and you're going to give 5 marks for that, it doesn't make any sense, because for 5 marks the student has to write minimum for 10 minutes, and the question that you have asked is a single liner. Yeah. If I
Madam,
say,
so
Yes, ma'am.
if
if I
I'm
say,
asking now,
yeah, please go ahead.
um, you also last time elaborated on the level of thinking or order of thinking.
Yes.
So if you go for essay, maybe we
Mhm.
can assess the higher order of thinking and give an elaborate question to be answered,
Yeah.
uh, where more time is required.
More
Because
time
for
is required.
For
Exactly.
recalling and all, we can give short notes
Yeah.
where only listing and maybe giving a simple classification.
That means recall questions you want to give
Yeah,
them.
recall questions. Yeah.
Not even comprehension, just recall questions. So SAQs can be recall SAQs, right? Like
Okay.
this. If you ask contraception for 5 marks,
Mm.
Madam, even the rest position of mandible,
hmm,
just like that, cannot be for 5 marks. It is
yes,
defined rest position of the mandible, and
hmm,
please state importance of the same. Something like that.
yeah,
Or, more focused. Short answer questions need not be short, but they
hmm,
have to be narrowing down to what the examiners can expect so that the
yeah,
objectivity is increased.
yeah. That is what we are trying to get the everybody on the same page, that when you are writing a question, it is not the length of the question that matters, but actually the content of the question, what you are asking, and how you are going to ask. That is very important. Can we improve upon this? Contraception, 5 mark question.
Mm.
Different methods of contraception.
Yeah, enumerate different methods of
So,
contraception, or you can say enumerate 3 methods of contraception for males or 3 methods of contraception for females.
mm.
Yeah, that will make it 6. So how are you going to divide 5 marks? So that also you have to check. Okay, so you can say give 5 types of contraceptions, each for male and female, something like that. So when you're giving a question, think about the marking also. Okay, don't ask them to write 6, or don't ask them to write 4 and then give them 5 marks on it. 1 mark, where does that go? Okay, so how you rightly said, the best position for mandible, you can improve this question by asking, can you ask them what is the clinical significance of this?
Yes, ma'am.
Yes, yes.
Hmm? Okay.
So, madam, giving them a tip regarding blueprinting.
Huh.
So, what is the level of the knowledge they are testing?
Yes.
And what is the marks allotted? What is the importance or weightage of the subject? All these things. Indirectly, I'm giving you some hints to prepare. Huh?
Yeah. See, this contraception one, you can say, either you say enumerate, or you can say describe one method. When you say describe one method, that means that method has to be described in detail. Or you can say, what are the advantages and disadvantages of oral contraceptives? How can you be more specific for this second type of question? Can this be further improved? Think about it.
Please mute yourself, everybody. Only when you want to speak, you open.
Can you improve upon this second question? What are the advantages and disadvantages of oral contraceptives? 5 mark question.
What are the five advantages and disadvantages of oral contraceptive?
Anything further? Further improvement. Very good. You mentioned 5. Any further improvement? 5
Mm.
each, can we say?
Yes,
Yeah.
sir.
Because if you just say 5, it could mean 4 plus 1 also, no?
Or it could have
Okay.
been just the side effects of oral contraceptives.
Yeah, that also can be asked.
So this would be an analytical question. Huh?
Yeah, so you can start with a lower order. The first example gives you that it's such a maybe comprehension,
Mm.
then goes for when you say advantages and disadvantages, that means understanding and comprehension, and then the third one goes to a much higher level also, right? Because you're asking them to reason out their choices.
So, madam, they apply the 20-60-20 rule,
Yeah, for their blueprinting.
right?
Yeah. Okay. So the second one which we said was the rest position of mandible. So which one do you think is a good one, and what would be the level of each of these questions? Can you tell me that? And is this a
Hemorrhage.
sufficient question for 5 marks? Is it too small, too short a question, too long a question?
Question number 3 is too short.
No, question. Let's start with number 1.
Mm. Describe one method of. Madam, it is too less.
Too less
Uh,
a question.
yeah, for 5 marks.
Yeah. So what else you can add to it?
So we might add start with the define rest position, describe one method, and then uh, the clinical importance of uh, ascertaining the rest position.
Okay. Or can you add the first and second together and make one question?
Describe.
No, no,
No.
madam.
No.
Second
Okay.
one is different topic.
Okay.
And Narendra, what you gave is a little longer. See, describe any one method of ascertaining rest position of mandible. This question can be little reframed, but
Mm.
it includes how they record and how they check whether it is the right position. So everything will come, na? It
So
is
that
rest
should be
position.
enough for 5 minutes, 5 marks, no? For
Yes,
10
madam.
minutes.
Yes. Yes.
Okay. So let's look at. So this is how you can improve your SCQs also, right? We discussed how we improve your LEQs and how you improve your SCQs. Somewhat similar, but whenever you are writing these questions, keep those checklists in mind so that you don't miss out on any of the points that we discussed. Let's look at short answer questions. Who is staying so close to the trees? Nice cuckoos.
Yeah.
Hmm.
Very nice, Kuku.
Yeah. So draw a picture of what you would look like in 100 years. I would say 50 years also. In 100 years, I will be dash. What type of a question is this? And look at the answer that is given.
Rest in peace.
What type of a question is this?
Yeah.
What is this dash line indicates?
Mm, completion type.
Completion type. Okay. Okay. Mention different types of SAQs that you know. Enumerate them.
Mm,
Short answer questions.
Um, Anybody from South? You have very short answer questions, no?
Yeah, we have seven. Today, how many people are present?
I think seven or
Seven.
eight.
So one eight, one each answer from each one of you.
mm, Short answer.
Madam, dentogenic
Like
concept.
like when fusion temperature in dental material.
No, no, I'm talking about types. I'm not asking for
Okay.
examples.
Mm,
I'm type A, B, C, D.
What is that ABCD? That's so nice. Okay.
No, they are
Madam,
attempting, madam.
completion
See,
type. Yeah, fill in the
there is
blanks.
completion type, which are also called as fill in the blanks. The second type is that you just ask them for definitions because you're giving them 2 or 3 marks for each question. So just asking definition would be enough. Then you have unique answer type questions where there is only one answer that you can give. Other type is you can ask them to draw a diagram, or you can give them a diagram and ask them to label it properly. And then you can give them a numerical problems, or you can give them open-ended type of questions. But again, open-ended type becomes too wide a thing. So let's look at the some of the examples. I'm sure you have seen those. Completion types, we all know. We just saw the first question was of a completion type only, isn't it? Fluorination of water prevents dash dash dash. How many marks you would give for this question?
1 mark.
1 mark you want to give? Okay. For definitions,
2 marks, ma'am.
2 marks. And label and draw and label, or label and label the diagram.
Depends on how complex the
How
diagram.
complex the diagram is. You can give, these SAQ are maximum 3 marks. So that's where you should ask them to draw a diagram which is not too complicated also. No, they are not going to be spending too much of time on it also. So these are the three types. The other one, unique answer type of questions, where just it's a single liner or two liner answer that you get.
Mm.
What does deficiency of vitamin C cause? Why aspirin should not be given in children? What is the function of lining under amalgam fillings, and what is the difference between pulpal pain and the periodontal pain? So these are the kind of questions where you don't expect them to write long answers. Just in the instructions also, you are going to tell them give answers in 1 or 2 sentences only. We don't want them to give long essay type of answers. So this is a unique, why you call it as unique answer type, because there is only one answer for that question that you are asking. There is no question of other any interpretations like that. So that's why they're called as a unique answer type of questions.
Madam, I have one question.
Sure.
In summative examinations, while
Mm-hmm.
setting the paper, the university sends a model paper.
Hmm.
And in that model paper, uh, there is no scope of giving instructions, like you just said that we need to give instructions.
Yes.
So how do we go about that?
Why there is no scope?
Because for example, the short notes is saying it's short notes, and then we
Okay.
just have to give three or four questions. So
No,
where do
okay,
we
three
give the
or four
instructions?
questions, but doesn't that mean that you can give the question which are self-explanatory a little longer than just writing
Yeah,
one word?
yeah,
Yeah.
of course that can be done. But
Hmm.
like you said, if for the entire section of short notes, we
Hmm.
want to give an instruction that all answers should be limited to one or two sentences, something like
No,
that.
that will be for SAQs, not for a SCQ.
Okay.
SCQs are that's why they're called as short essay questions. You are giving them a scope to write a little more than
Okay.
SAQs and give. There can be two or three maybe answers or opinions. They can give a little longer tick. Whereas SAQs, it is going to be a single one. Say, for example, why adrenaline is combined with local anesthetic.
Okay.
Those kind of things where there are very specific answers to that. There is nothing that the student can write beyond that. Those kind of questions you can write.
And
Any other question?
should we give word limits also, ma'am? Sometimes it is.
Not required, actually. I don't know. Word limits is good when you are assessing their writing ability. Here you are not looking at their language writing capacity, no? So moreover, when you are setting up your question paper, you are dividing the marks based on the time that you are giving. As I said, for each mark you are giving them 2 minutes. So if it's a 10 mark long essay, that means 20 minutes are gone in writing one long essay. So that way, if you maybe specify when you're preparing your questions also, then you know how much time the student is going to spend on it. So you don't have to give them the word limit, but give them the marks on that.
And one more thing, ma'am.
Sure.
Recently, since 4 5 years, in
Uh-huh.
the MDS part one, we have a part one paper
Uh-huh.
at the end of 1 year, and the question paper pattern given by Dental Council is 10 questions of 10 marks.
Mm-hmm.
And in the last 5 years, I have seen maximum failures in this paper.
10 questions of 10 marks, 100
Yeah,
mark
100.
paper.
And 3 hours.
3 hours. 3 hours is roughly 180 minutes, right?
Yes, ma'am.
So almost double the 100 marks. 200 minutes you should give. They are giving you 20 minutes less.
Yeah.
Yeah. So
And no instructions given as to how exactly they should answer.
that is where you need not depend on sorry, not drug controller, your DCI.
Yes.
Okay. At your university level, at your college level, can you MDS question paper, if it is coming from the university, can you not put in these suggestions to the academic council of the university, send them a letter and saying that this is how the thing should be, and we need to modify the question papers. We need not follow what was done 50 years back. Same thing continues. What is the
No,
point
ma'am.
in?
This pattern was introduced 5 years back,
Okay.
5 6 years back.
Okay,
Previously, it
fine.
was a 75 marks paper. Now it
Uh-huh.
has become 100 marks.
Yeah. So, what would be an ideal situation would be you try to get the maybe results of the students with 100 marks and get the results of the students with 75 marks. Compare them and
Okay.
see if the results have improved or gone down, and the type of questions which have been given in these two things, and then you
Okay.
can make your case and write to the university. I'm sure university will consider these suggestions or whatever you want to say regarding this.
Okay, ma'am.
Any other comment, or shall we go to the next part? Can we move on to the next part?
Yes, ma'am.
Yes. Okay. So we are going to look at what are called as modified essay questions. We saw what are the shortcomings of essay questions. Sometimes you just they are not formulated properly, they are not structured properly, and they are not actually, the purpose of giving essay questions is to assess the higher order thinking, not recall. Recall, you can do it in SCQs or SAQs. So the idea of giving long essay questions is to check their HOTS, or higher order thinking questions. The same thing, now we are looking at modified essay questions, and why they are called as modified essay questions. So sorry. Okay, let's start with an example. Can one of you read this case vignette that has been put up here?
An 18-year-old female patient reports to dental OPD complaining of severe pain in relation to upper left molar region. On examination, there was no evidence of caries or periodontal disease.
Is this a common clinical scenario with which a common complaint with which the patient presents to your OPDs?
Yes, ma'am.
Yes.
18 years.
So, so you want your maybe BDA student to be able to handle this patient, right? So the questions then that are asked are, what are the points that you would like to ask or elicit? How would you elicit the further history? Hmm? Or what are the points that you would ask in a history taking, for which instead of asking what are the points, now I think I need to modify these questions. What is wrong with all these four questions? Can anybody comment?
This is something like a real life scenario. We are
Okay.
asking a practical question and uh, a comprehensive management of a particular problem.
Okay. Now, that's very good, fine. But what I was pointing out is more of a maybe the way the question is being constructed. Now, instead of asking what are the points and you're giving them 2 marks, so you can ask them, mention 4 points that you would like to elicit during the history taking. Similarly, how would you modify the second one now? Tell me. That again, you're giving 2 marks for it.
What essential investigations are required?
Essential is again what is that is something I was told by some international faculty, that when you are asking question, don't ask what, be more specific. So you can be more specific here. As I said, mention the first question I said, mention 4 points that you would like to elicit during the history taking. So you can say, mention 2 investigations or maybe 4 investigations. I don't know how many investigations you need to do. That will help you to come to a diagnosis. Okay. Now, what would be the third modification? The third question, you are giving them 4 marks.
Ma'am, enumerate the differential diagnosis for
Yes.
a particular scenario.
Enumerate the differential diagnosis and give your provisional diagnosis. Isn't it?
Yes,
Without
ma'am.
the investigations, And without the complete history, will he be able to give a diagnosis based only on this much of a history?
No.
No. So you have to ask them based on this. This is where the modification of the essay type of question comes in. So just remember these four questions that we are asking. Fourth will be, what will be your line of management? So you can say, describe your line of management, or how would you manage this patient, something like that. But
Madam,
unless you have answers for the previous three questions, the fourth question cannot be answered,
yes, ma'am.
right?
Yes, ma'am.
So that
Exactly.
is where your modification of the essay comes in. So, modified essay question are the questions that deal with the problems which are typically encountered in the general practice that might be presented to a GP. The content may vary from a common clinical problem or an environmental issue which affects the community. The basically these are designed to test the decision making skills of the students. So what, how is the MEQ constructed? The design and construction of the MEQ, it begins with a brief scenario of patient presentation problem, presenting with a problem, which is followed by a short answer questions. So you're giving them short answer questions which they can answer in couple of sentences, right? Then you follow it with, it seeks explanation or justification based on the knowledge of underlying mechanism involved in the problem. Allocate the marks and time for each item, and the marking has to be done using a predetermined model answer questions. So basically, as I said, it starts with a clinical vignette, and totally you're giving them 5 to 7 questions to answer. The questions and the things are given sequentially. So the first sheet of the question paper would contain the clinical vignette, the clinical information, followed by questions, for which the student will answer the questions in that sheet only. Then you give them the next sheet where the further information is given. They will answer to that question. Then the third sheet is given, which gives more information, and then they will answer those questions. So let me explain this better with an example. So what you do is, first you give a clinical history, then in the next part you can give clinical and physical examination findings, ask them about diagnosis and assessment of the condition, management including investigations, complications, prognosis, and health education. All this can be used in or asked in MEQ. So let's take an example. Before we actually go on to this, let me give you what we at an international medical school, which I was teaching there for a long time, which was affiliated to a Malaysian university and accredited by WFME. There we had 20 marks of MEQ. 20 marks of MEQ consisted of uh, two MEQs. So each MEQ was for 10 marks. Now, how that was divided was, the first sheet, which was of, we used to give each student a brown paper envelope, big envelope of brown paper, and that had 3 sheets in it. One was the white colored sheet, which was the first sheet, which had the questions for the first part. The second sheet was a blue sheet, and the third sheet was a yellow sheet. Now, once the bell rings, they take out the white sheet and answer the questions on the which are asked in the white sheet. Now, suppose you have given them the history and then you ask them what other history points you are going to ask, or what is the physical or clinical examination you will do. They will have to write the answer in that white sheet. Now, suppose the questions are there for 1 plus 1 mark or 2 plus 1 mark. So that means 3 marks. So you're giving them 6 marks. At the end of 6 marks, there is a bell that is rung. The student is supposed to insert the white sheet back in the brown paper cover, remove the blue sheet, and answer the questions which are given in the blue sheet. Once the time that is given for the blue sheet is over, again the second bell rings. The student puts back the blue sheet and takes out the yellow sheet and answers the questions on the yellow sheet. Now, here the student is not allowed to go back to the white sheet or the blue sheet when he's answering the yellow sheet questions. We have managed 196 students at a time, of course, in smaller batches, groups of 25 in each room with a supervisor without any problem. Only thing is the way you put these sheets, no, and the instructions that you give is important. And nowadays, these MEQs can be given on computer-based MEQs are also can be done. So this is why I'm giving you this detailed thing is it is very much doable in our condition also. Okay, in India it is doable, possible, and for you people it is possible to do it as a formative assessment. You may not be able to do it for your internal assessment, you may not be able to do it for your final assessment, but you can use it for your formative assessment. Excellent way to check whether the students have understood all the concepts, and you can very easily give them the feedback. You can tell them that, see, your diagnosis was wrong, so you need to concentrate. When we have given you all these things, you should have come to this conclusion. So your thinking was wrong, your complications, you have not answered them properly. So those are the points that you can discuss with them if you're using MEQ on a formative assessment basis. So let's look at one example now. You can all read the first case vignette, which is given in blue. He's been asked to brought to ED, that is emergency department, by his wife. John woke up this morning 1 hour ago with nausea and vertigo. He managed to walk to the bathroom but had to hold on to the furniture and walls to steady himself. He vomited when he reached the bathroom. So this is the first information that you're giving. Based on this, you're going to ask them the following 3 questions, right? Give 3 differential diagnoses to account for John's condition. Looking at only this much of information, you can think about 3 differential diagnoses for which 1.5 marks is given. Second, explain the mechanisms which give rise to John's condition. So what are the conditions that he's suffering from? Nausea, vertigo, and balancing, not balancing. So what are the mechanisms which are responsible for this? That also can be given 1.5 marks. And the third one is, what further information would you like to distinguish between your differential diagnosis? So you have made some differential diagnosis in your mind. To come to a possible conclusion, what are the information you would want them to give you? That you need to write, the student needs to write. Explain how this information will distinguish between the diagnosis. So sorry for the spelling mistake here. So they need to tell you what further information they require to make a final diagnosis and how they are going to eliminate those differential diagnoses. So this can be, you can have this question for maybe 20 marks or 10 marks, whatever it is. The whole, I'm talking of the whole scenario, not only these three, the further questions also. Okay. Is this clear?
Yes.
Any questions on this?
Ma'am, MEQs needs to be clinical scenario based, or it could also be asked in a form of during the examination when we give it for assessment, formative assessments.
Informative assessment, it has to be clinically based. When you are giving a thing, it has to be, the MEQs are clinically oriented because you want them to develop the thinking skills, critical thinking skills. The objective of giving MEQs is not just a recall or comprehension. You are looking at a higher order. So you want them to do the analysis, you want them to come do the evaluation part of it. So critical thinking part of also comes in. So you need to give them on a clinical scenario. We used to give these clinical scenarios even for first MBBS, anatomy, physiology, biochemistry, all three together, one paper. Pharmacology, pathology, and microbiology together, one MEQ. And then, of course, surgery, one MEQ, medicine, one MEQ, those kind of a things. So, okay, can we look at the second part of this? So, this is the white sheet that we give. The first one, they will answer these three questions and then insert that paper back into the brown paper cover and then take out the next blue paper. So the blue paper, the additional information you asked them for, see, the question that you asked was what further information you would like to have. So the further information that they give you is that the John has no significant medical problems, and for the last few years he spent the previous evening at home watching TV and not drinking any alcohol or take any other substantial substance, or on physical examination these are the findings that they have. The left pupil is smaller than the right, John's uvea deviates to the right, and movements of the left hand are clumsy. So this is the additional information that the student gets. He has the first question. Part 2, he gets this additional information. Now, is this the one which he had asked for? We don't know. Anyway, now the questions 4 and 5 that are asked are, what is your provisional diagnosis now? When you have got additional information, see, the first question, the previous question you had asked was 3 differential diagnoses. Now you are asking them for a provisional diagnosis with this additional physical examination and history points. And the second one is enumerate the investigations you would like to request for John with justification. So this gives 1 mark and 3 marks. So totally 3 marks for this section, part 2. So the students get 6 minutes, 3 marks, so 6 minutes to answer this question. At the end of the 6 minutes, they will answer this and give them, keep it back in the brown paper and take out the yellow sheet. Now, once you have asked this question, you are giving them some space here, maybe based on the answer, expected answer. 1 or 2 lines are given for them. So they write the answer in this space only. They don't write the answers in a different sheet. They will be writing the answers, each one of them, on this paper only. Shall we go to the third section? Or you have any questions on this? Is this clear?
Yes, ma'am.
Yes, ma'am.
Okay. So now the part 3, as we said, the further question, you have this clinical thing and the John has no blah, blah, blah. Then continue unfolding the scenario. You give some more information and ask them for questions like that. Okay. So this is how your MEQ. The third question I have not given the details. We will discuss that when we're looking at a. Uh, so what could be asked in the part three now? Tell me.
The treatment part, ma'am.
What is
Treatment
your
part.
final diagnosis?
Yeah. What is your final
Final
diagnosis?
diagnosis.
So in the third part, what is the additional information you are going to give them?
Get the investigation reports, man,
Yes, give them the investigation reports and then ask them for the final diagnosis
and management.
and management, or management and complications,
Follow up. Follow up also, ma'am.
follow up or something, or what else can be asked? Suppose they don't take the treatment, what happens then? Okay, so that would come, all that would come in the part 3 of your MEQ. So this is another example. Can somebody read this?
Mr. Shastri, aged 51 years, with a history of pain and swelling in the upper lip, presented to a general dental practitioner for treatment. The general practitioner extracted the offending tooth and referred the patient to a prosthodontist. The patient consulted the prosthodontist to replace the missing tooth with fixed denture.
Okay. So the first question, first part, you are given them the history and asking them, mention two important points in the medical history that you would like to ask for his age. How old is he? 51-year-old. Okay. Second question is, describe four relevant points of dental history. So the first is general medical, the second is the dental history, and the third one is enumerate two preliminary investigations that you would like to get and explain why. Okay, though here I have shown the questions one after another. As I said, you are going to give them a two lines space, leave the space so that they can answer them in that space. Okay, so the next section, read this, the investigation.
The investigation report reveals fasting blood sugar levels 156 milligram per deciliter, and the radiograph of the patient is shown below.
So this medical thing, they're telling that what does that 156 milligram per deciliter tell you?
It's a diabetic or non-diabetic. It's a
Yeah.
diabetic patient.
Is he a diabetic patient?
Yes,
Yeah.
ma'am.
Yeah, he's a diabetic patient. And the dental, you had that also asked for specifically for a dental history, isn't it?
Yes, ma'am.
Yeah. So the patient here shows, or the examination, sorry, the investigation shows this radiograph. So based on that, you're asking, write your diagnosis and describe other investigation that you would like to advise. Other than now radiograph is done, what else can be done?
Diagnostic impressions and mounting, ma'am.
Okay, so let's see what is being told, asked here.
HbA1c.
The further blood investigation revealed that his HbA1c was 7.5. Radiological shows. Write a complete treatment plan for this patient and explain four factors that affect your treatment plan. So I hope you get a general idea of how these MEQs are being framed.
Yes.
Yes?
Yes.
Any doubts on this? Any questions? Any can you
Definitely,
use these?
definitely it would need a lot of effort from the teacher.
Yes, but will it be of use to the student, and will it be of use to the faculty?
Both, ma'am. In terms of assessment also, and in terms of gaining knowledge.
In terms of assessment also and gaining knowledge also. What do you mean by assessment?
Ma'am, to understand the problem solving ability of the student,
Okay,
so and also to know his cognitive skills, how he
okay,
could able to represent.
okay, good. So that's about the student. What is the benefit for the faculty?
Mm.
You said that disadvantage is that it takes time for, yes. Now I'm asking about advantage. Does it have any, do you think that it has any value or any advantage?
And based on the assessment of the result of the assessment, teacher can modify the teaching methodology, how we could, you can correct
Exactly. Exactly. So the teacher can see the answers and say, okay, these people do not know what medical history they need to ask. So you need to tell your medical medicine people that they need to stress on this, or they don't know the differential diagnosis for these common conditions. So you need to give more time to discuss those things. So by taking these questions, you also get a feedback on
Feedback from
where,
teaching.
yeah, you get a feedback on what to modify and
Madam, I think
yeah.
students also will become more serious and interested also if we give.
Yes, yes. Students get interested because they know that these are the cases that they're going to, you are going to ask them the
Yeah.
common conditions that they are going to see in their clinic, right?
Yes,
The key word here is assessment drives education.
yes,
The assessment level is higher, students also will focus more on what parts they should learn, how they should learn, and how critically analytical they should be.
Yeah, so this kind of assessment, you can use it for assessment for learning very easily. So to summarize, proper structuring of essay questions provides an excellent platform to assess the higher thinking skills. Whether it is a long essay or whether it's a MEQ, it gives you a platform where you can assess their higher thinking skills, right? You agree with the second one?
yes, ma'am.
Yes.
Madam, why it is called as delimiting and not limiting?
What is delimiting?
Actually, delimiting is expanding the scope.
No, you delimit the scope, limit the scope. Directive verbs
Yeah,
and, yeah, delimiting the scope. So you don't give them a wider scope, you limit it.
it is a little confusing because the word used is delimiting,
Delimiting.
which is opposite of limiting.
Hmm.
Should we abandon? We have to make it more effective.
Should we abandon?
No,
Many
ma'am.
of these international, see, if you look at in USA, these fellowship programs, they have stopped asking essay questions totally. So this is the same things we can ask in other ways, MEQ especially, or they have another method, what they call it as patient management problems, PMPs. So in our situations, maybe we cannot abandon them totally, but then we can make it
Delimiting the meaning is to fix the boundaries. So
okay.
madam is right. Yeah.
Okay, ma'am.
It is not the opposite.
Okay, ma'am.
So anytime you write a question paper, there are two important things that you need to do. One is preview and review. Preview to predict the student responses, how you think the students are going to respond to the questions. Then by previewing, you will also be able to write the model answers. That's very, very essential if you want lesser inter-rater reliability and increase the validity of your assessment. You need to make an effort to write a
Model answer.
model answer and ask knowledgeable colleagues to check for clarity. This is very important. Many a times what happens, we think that whatever questions we have written is proper. When we understand it the one way, and somebody else when they read, they might understand it some other way. So the best way is to ask your colleague to read and check the questions that you are written. So preview of the questions is important. And what review you will do? You have in the first preview you're predicting the student's response, right? And in the review you're going to see if your
Actual
predicted
response.
response and actual response match. So that will increase what? Reliability or validity. How would you improve your reliability of the assessment, and how would you, what are the other aspects of assessment that you look for when you're planning for assessment? One is reliability, one is validity. What are the other things that you look for?
Objectivity.
Okay, what else?
Uh,
Ma'am, inter-examiner variability.
That will come in reliability, right? What else do you look for? You heard the term feasibility?
yes, yes, ma'am.
Do you look for feasibility? For example, now what we discussed about MEQ,
Mm,
will it be feasible for you to implement those?
yeah. Unless the university allows for modifications
Hmm.
in the pattern, till that time we may not be able to
You may not be able to use it for
use it
what?
in the summative,
Summative. But you can use them for
formative.
formative assessment, right? So feasibility. What else?
Clarity, ma'am.
Hmm? Clarity.
Clarity.
Yeah, that will come in your objectivity and validity also. Anything else?
Acceptability by the
Acceptability, very true. By whom?
Students.
By students and
Uh,
who else?
Colleagues.
By college, yes, very good. Who
No,
else?
colleagues.
Colleagues, who
By
else?
university.
By university.
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 And who else?
Mm.
Ultimately, who is responsible for this?
The council.
DCI, absolutely. So, whatever you're doing should be acceptable to all these people, right? Acceptability. What else?
But here, don't misunderstand that if the DCI is not giving the format of MEQs, you cannot use MEQ for your students to learn better.
Yeah.
Madam said that assessment for learning.
When you're
No,
doing
but
it
ma'am,
for.
in summative, most of the, I don't know, in a private university, they always say that just follow DCI, just follow DCI.
No, but we are
In
not
the
discussing.
summative,
Yeah,
I
we are
am
not
asking
discussing here
you,
for summative, no?
and I'm not asking you for internal assessment. I'm not asking you if you are having terminals. I'm asking you that apart from this exam, as
Yeah,
a method of increasing the student's potential to
learning. Yes,
critically think, you can give the test.
yes,
Because
ma'am.
multiple tests, in fact, I had once discussed with you that when you are giving competency based education or outcome based education learning, continuous assessment is required. Then only you will keep in touch, I mean, keep in align with the all the SLOs and your purpose of what the students are able to do.
Yes, ma'am.
Yeah. One more thing that you need to look at is the what is the educational impact of your assessment on the students. If your question paper is only recall and only at a lower level, the students will end up doing only superficial learning, isn't it?
Yes.
Whereas if you give them MEQs or higher order LEQs, then their academic impact is going to be much higher. So when you're
True.
looking at an assessment, all these points you need to keep it in mind. Validity, reliability, feasibility, what is the academic impact of it, what is the acceptability of your assessment. You know, some for internal assessment it may be different. When you're doing formative assessment, maybe validity and validity may not be at a very high level, but you would look at its educational impact and you would rather look at its feasibility. But when you're doing a summative assessment, you are going to look at the validity, reliability, and other aspects of it, like its educational impact. Fine?
Yes, ma'am.
Okay. So,
Ma'am, I have a question, ma'am.
sure, go ahead.
Ma'am, who will write these model answers, ma'am?
The person who has set up the question paper,
Okay.
and then ask a knowledgeable colleague to check for the clarity and correctness of the answers. That's also very important.
Okay.
Hmm?
Okay.
So,
Madam, if at all this pattern is used in a summative assessment, like you
uh,
said, you were using it in the place
yes,
where you were
yeah,
teaching.
mm,
Uh, does the paper setter supply the model answer so that
yes,
because the
yes, yes.
assessor may be different?
Yes, yes, we do. And when somebody else comes for evaluation of these answer sheets, no, the
Okay.
first thing that we give them the model answers. Everybody
Okay.
go has to go through those model answers, look at them, and then start marking those papers.
Okay.
Anything else? Any other question?
I think we all of you should come out with some doubts that you have, because this is a very important session. And what I want you to do is prepare the MEQs yourself, and now use the peer learning method, make or
Yeah.
the group learning. Join in the group of 3 or 4, and like you can just join 1, 2, 3, 1, 2, 3 something, 3, 4, 4, 5, 6 something, and then come out with the answer. Last time, madam had given some homework to you to prepare, to look at the question paper of last few years
Yeah.
and come up with certain things that you may critically, you have found out that it can be improved. Not necessarily, don't look into it critically to just to take out something, but at the same time you can always share with us some questions. Have you done? He was clearly told you to take out last 5 to 10 years
Yeah.
question paper and take out some questions that requires attention, and some questions which really did not convey, it's not valid properly, and it is not, so hence if it, reliability is not there, validity will not be there. Validity is not there. Madam, if
Hmm.
the question is valid, for what purpose we are asking, that is one thing.
Hmm.
But the reliability, inter-rater reliability,
Yeah.
what that is very, very important. That
Yeah.
is the reason, at least in the form of a model answer, you can give the points what they can cover. I don't want you like 12th standard, the whole answer to be given, one grammar or one comma is gone and they don't give marks. Not like that.
Hmm.
The gist of it.
Say, for example, there are 10 complications. Now, in your question paper, you are asking them only to give six. Now, which are the six ones which are very important that they should know? That will go in your model answers. So that the examiner also will see whether those 6 important ones have been mentioned by the student may answer the ones which are not so important, the last 4 ones, then he doesn't get the full marks. Just because he has answered 4 doesn't mean he's going to get half the marks because he has answered something. No, if he hasn't answered the ones which are really important, then he doesn't get those marks. That's where your writing of your model answer comes in
See, you
picture.
don't have the freedom for your summative exams to declare the people or students below certain percentage or completely declare them fail. But you do have the freedom in the formative exams, and that is how you create a mass of students who become really involved and not end of the year learning with just mugging up, forgetting. The rote learning has to be stopped, right? We talked in the first session. In India, it is the rote learning. If you include this MEQs, these essays, which is modified, gives a lot of clarity of thought for the student. Now he should go back and learn what is missing, the missing links he gets. We need to prepare MEQs and present it.
Yeah.
But
Maybe one
you have,
session you can do that.
madam, next session, I want them to, each one of them, can I here tell you that we want you to assess, each one will assess last 5 years, pick up their own and give a reason whether the question is valid, whether it is reliable, whether it is the question has objectivity, all those things. Will you do that for next time? Each one of you, one question or two questions? Huh?
Yes, ma'am.
Yeah. And the
Yes,
second
ma'am.
is prepare 2 MEQs each or 3 MEQs each, because you can prepare. See, you give a clinical condition, you give a dental history, as madam has told. We also, madam, in dental, in the American Implant Society and all, when I had appeared, of course, I appeared 20 years back.
Hmm.
That time we had EMQs, extended matching question.
Yeah.
They're similar, but what
Yeah.
they used to do is they used to give one paragraph of this question, and the
Yeah.
next paragraph was an application, so that basic medical sciences, like
Yes.
example, the local anesthetics, how many maximum doses can I give to a
Yeah.
patient because of whatever his
Mm.
conditions, alcoholic and other things, that he's it's not acting. So whether I know that, whether I know the condition of the patient, and how do I calculate this dose, the maximum dose, and all those things. So, and lots of other small things came up. So in dentistry, EMQ though is possible only, madam, in NEET and
Yeah,
all.
I know. Extended matching questions are very good actually to assess the higher order. I thought that would have been covered in the MCQs that was done. I thought the session on MCQ is over, isn't it? So
Yes, madam.
that's a
Yeah,
good one. Yeah,
yeah, that's a good one. So
yeah.
next time I want the presentation will be from you people, and also the presentation for blueprinting. Is everybody, can we stop sharing and see you all?
Sure, sure. I will stop sharing.
Please, if you can put on the videos so we all can see each other.
Just a minute.
Yes, madam. Okay.
Yeah.
So next time it's easy for you to just spend an hour or two, take out question paper from your library you already have. Is that collection of question paper called question banking?
No, ma'am.
What is question banking?
Question banking is a systematic method of
Yeah, yeah.
formulating different
We'll
types of
spend some.
questions. Mm.
Yes, yes, you're right. You're right. Very much right. And we will, the scope of question banking and how it is done and how the Excel sheet is made, we'll discuss about that also. But the important thing for you for next time is take out 5 years question paper, take out three questions, each in removable, fixed, and maybe maxillofacial or implant or whatever you want, and take out one or two questions from BDS level and one from the MDS level, and you need to present it. If you want to join as a group and do it, then you select your group and send in the WhatsApp who three are groups. Okay, three and four. Actually, I don't know whether Anand is joining, because I think his father's 13 days are not completed. His father passed away, isn't it? And Meenakshi will be joining next time, and she will pick up. Sandhya, please share with Meenakshi, and she can also ask us or me in case of any
Yes, ma'am.
clarity.
Yes, ma'am.
So next time, this is one task for the first hour. The second hour, you will present MEQs. Again, you can have your group and you can prepare a MEQ. Doesn't matter. And I will show you some examples next time of dental. And I'll show you examples of MEQs, what we prepared. I will show you, but you also, I will be home next time with my laptop. So we will discuss that. And after that, that's Tuesday after that, you are going to present uh, blueprinting. And I will give you a lot of tips on blueprinting, because blueprinting, if I talk or Madam talks or last time Manohar talks, what happens is your focus is less when you are not actively
Yeah, yeah.
interacting. If you are very active in your interaction, so you pick up but you forget. You understand? See, the validity, reliability, physics, they should be on your fingertips when it was taken by either Gaurang or Chinmay. And we all talked about this. And you saw those diagram, whether it is always coming, hitting the bullseye or around it. But you should have now thought of the translate it to the questions, the answers. What does it mean in our scenario? Everything what you see should or hear should be useful to you, because this I told you in the beginning, this is a course where you learn in your workplace by implementing it, by doing it. Okay. So anybody wants to uh,
Having
ask madam certain because madam may like to leave, but
yeah.
I want you to ask her certain questions.
Any question?
Anything to be repeated, or you want to share something,
No.
anything of assessment.
What percentage of or the what component of a question paper is usually MEQs? If it's a if it is a summative,
Okay, if
uh,
you remember what I showed you last time, there are two MEQs, two SEQs of 10 marks each, so 40 marks there, and 60 marks of MCQs.
MCQs. Okay.
That's how the question paper there was distributed for summative.
And in the given scenario of ours,
Mm.
you can have the the knowledge levels equally distributed. As madam said, recall can be only 20%. You want to address the easy questions for the students, so to in order to know how much they know, just not the difficulty but also the recall
Simple ones, yeah.
questions, simple ones. And also you want to ask the understanding, comprehension and application 60%, but analysis also. But when it comes to evaluation, synthesis, you
So,
ask only 20%. So the lower order of thinking and higher order of thinking is completely has a very good confluence by that way. And this is what is blueprinting actually. How much, what level, which type of question, what is the weightage in the see today. COVID has become so important in the medical clinic with the clinicians that anything to do with the COVID and COVID variants and influenza, etc., that question will have a greater weightage. And if you say yellow fever, it is not prevalent across the globe. But yes, yellow fever is important. The weightage will be different. I'm just giving a
so
broad example to
yeah,
you.
it
Yes,
also depends on how much time you are spending in teaching that particular topic, you know.
yes,
Yeah,
yes.
important. I don't know I can't give you the dental examples, but for example, in pharmacology, if I'm going to talk on antibiotics, especially the ones broad spectrum antibiotics which I used across all specialties, I'm going to give more time for that in my total timetable. Say maybe out of 40 hours of antibiotics, I'm going to spend 20 hours for broad spectrum antibiotics. So if I'm spending 20 hours for that, I will give them the
Assessment.
questions assessment related to that time that I'm spending them for teaching. No, that's where you are again, that will come in your blueprinting
And
Okay.
also clinical applicability,
application.
use of the, say the application is so important of composites, the newer composites. So, and how much time are you spending appropriately? One LAQ or something should be asked,
Yeah.
isn't it? Yeah, directly, indirectly, it has to be covered. How much syllabus you are able to give a justification of coverage is very important. I think one session we will do with you when you have breakout rooms. I'll arrange for that. And then when you have breakout rooms and answers come, then you all are working together and we'll do that. Yes?
Okay.
Yes. Thank you.
And anything else? Sandhya, you want to ask anything?
Ma'am, ma'am, I want to ask one question, ma'am.
Yes, yes.
Ma'am, how do we train ourselves to create SEQs, ma'am? Because we are not trained in that set, ma'am.
In MEQ or SEQ?
Mm-hmm.
SEQs, ma'am.
This is the
So,
best platform. No, you start prepare, have a peer group, and okay, you say that okay, I'm going to, but that's by learning by maybe error and thing. You start preparing, and then one of you bring those questions to the table and start discussing them, how this can be, the way I put it up, no? And asked you how it can be modified, how it can be improved upon, or is this okay, or anything else need to be added. So you start practicing that way as you keep critiquing the questions, and then you'll start writing better questions that way.
It's all
Right?
by practice. It all
Yes.
by practice and sharing with the peers.
Sharing, that's very important, that
Yeah,
having a
yeah, yeah.
sharing and getting a
So next
feedback from them.
time is the first opportunity for you. If you are interested, then I will be 10 times more interested than you, and we can have some sessions. The way we design the session will be different for you then.
Yeah.
Okay? Arun, only have to do MDS, I think. You are not a BDS. It has BDS. Army has BDS.
No, ma'am, we don't have.
Huh. But in the future, you may like to go to a dental college.
Maybe,
So
ma'am.
you have to, yeah. In the future, long time, you're just joined. Yeah. Rohit, this is a very good beginning for you. Now, question is, whatever Narendra is told, probably he is able to make an impact and make the changes in his institution with a little better edge than rest of you. Maybe
Yes,
Sandhya
ma'am.
also can do it, being a senior staff member or a middle level staff member like Meenakshi and all. But Rohit, when he says something, the head of the department may say that please keep your new learning and don't show off.
Yes, ma'am.
I mean,
Correct.
in that, so
Yeah.
then now your leadership thing comes as to how you
Exactly.
will
Convince
show
them.
example, doing and showing in your own class. If you apply this and show the results and how the students are learning, one, the students will be after you to learn more. Students learn from teachers who teach,
Correct,
and they
ma'am.
want to be, they respect them, and they know one who comes and does something and goes. How do you
Yes.
respect Veda madam? A lot, isn't it?
Yes, ma'am.
Because she is given a lot of things to you. That is how you respect, and that is how you look forward. So, do you don't want to be a teacher like that?
Yeah, ma'am. We want teacher like that only.
Yeah. And given all the handicaps of a institution, the limitations, it's up to us to show how much you can do
Yes,
and what
ma'am.
we can do. Whatever makes us happy, you do. I am from the same background as you in a government institution, but nothing stopped me from doing something differently. And that's what makes you feel happy.
Yes, ma'am.
Exactly what you do in your class, when at the end of the lecture, if you want to assess them, nobody stops you from taking a small MCQ test or a small, give them some SAQs or give one MEQ after you have finished a topic. Nobody stops you from doing that, isn't it? And once the students know that this will help them understand the subject better, and things, they will ask you next time to give you, and especially if they know that this is, some students may say that this, if this is not included in the our final marks, we are not going to give more importance. Some students may do that, but then again, as madam said, your leadership skills will come in handy there to see how you can convince them that learning is more important. Yeah.
Yes, ma'am.
More than the students, madam, some of the teachers say that why do you want to do all this and increase my work?
Correct.
Yeah, that's true.
You
Colleagues
don't
might
have
say,
to,
colleagues
you
might
don't
say,
have to
don't do
answer
all
them
this. Yeah,
immediately.
yeah.
You see, the actually person wants to feel good and do good, and he wants to be in his comfort zone.
Hmm.
At the same time, it's your duty to make the person next to you feel good. The feel good feeling what you give to the students and your colleagues makes you actually more lovable. That is what is important. If you just say something which is nasty, like you don't know what it is, the education is such a advanced, I am doing the course, then he will think you better do and keep it to yourself. They will not allow you to use it. But if
Yeah.
you say, yeah, but some other time I can share and take your opinion also what to do. It's all in the words.
Yes,
It's
ma'am.
all in the words and how you talk right from your children, especially with your spouse and at professional place. Isn't it, madam?
Very true.
Yeah,
Absolutely.
yeah. Otherwise, if you become mature and learn, no, by that time the retirement is very close. So better learn now only.
Yeah, ma'am.
Don't postpone it. That's it.
Yeah,
Nothing is
somehow
going
I
to fall
convinced
over.
for my project also. Earlier they told it's why you want to do here. Then I told some benefit will be there. I'll put your name also for the publication and all. Then they told, okay, okay, fine. Go ahead. If something is there, we'll do it that.
Yeah. So
Very good.
next time, are you ready to present?
Yeah, ma'am. Fine.
Take out 3 questions
Okay.
which you feel that it can be improvised. Take out some good question also, if at all you want to just say that this is a question. But remember, just asking one essay question on maxillofacial prosthodontics, essay question for 3 hours. I mean, I
100
think
marks,
it's
huh?
high, 100 marks.
Uh,
We have to have a little bit giving a narrowing down clarity to the students as to what is expected, right?
exactly.
That is why he writes same words again and again in every paragraph, because he knows most teachers who come to the correction hall, they don't even read. They just correct. One teacher told me in 1 hour, madam, I corrected 60 papers. I said, how? He said, kya madam, sabko ek do de diya. He gave one or two to everybody. Because
That
what
that's
section?
that's a common
Very
thing that they do, no? Very unfortunate, but नहीं तो सबको
yeah.
passing दे दो.
हाँ, सबको तो पासिंग सब लोग देते ही है मैडम, बिकॉज पासिंग नहीं करेगा तो उसके ऊपर वो प्रिंसिपल के ऊपर मैनेजमेंट, प्रिंसिपल इज इन बिटवीन सैंडविच between the faculty and the management and the university and the dental council. So in private college, many people don't accept only principalship.
Oh,
Yeah.
okay.
Unless there is a freedom to make some impact, some change, they will not take
Yeah,
the leadership.
responsible.
Yeah. So, madam, I thank you very much for the session. It
Thank
was
you.
brilliant.
Thank you for
And
calling.
madam, MEQ का भी
Yes.
एक article भेजना. I promise you this time they will read.
I have shared it on the group, MEQ
Yes,
one.
ma'am.
Okay.
I've
We will
shared
read
it.
it. We will
So,
read it.
yeah.
I
So
want them
this
to read
time,
it now. At least now go back and read and see if you understand what is written
see,
in
what you do is spend 20 minutes every day, and in the weekend have a meeting with your group. And will you put in the group immediately by tomorrow who 3 are together? Like Sandhya, Arun, Rohit, then it can be Narendra, and who else is there? Jyoti, and who is present today? Uh,
Shilpa,
sheet.
Shilpa, and Mirna, and can be
Meenakshi.
one of the groups, Mirna and Meenakshi. So if you make something like that,